we are the group 1 and our topic is preoperative. So my name is Zara Kazel A. Mahajud. So let's start with perioperative. So perioperative, it used to encompass all three phases. So perioperative nursing provides nursing care before, during, and after the operation. So the three phases of perioperatives are preoperative, intraoperative, and the postoperative. So when we say preoperative, meaning pre, from the word pre, means before. So it occurs in the time or period before the surgical operation. So next is the intraoperative. So this is the time that the client is admitted to the operating room, and the postoperative is the care is given after surgery to the client and discharged from the hospital. So preoperative phase begins when the patient is informed of need for surgery and makes the decision to have the surgery. And then next, the preoperative assessment, pre-admission testing. So when we say pre-admission testing, this is the necessary step para ma-ensure yung health and safety ng patient before mag-undergo ng surgery. So number 1 is initial preoperative assessment. So preoperative assessment, like dito i-identify yung patient kung with comorbidities ba, to avoid complications. Next, initiates teaching appropriate to patient's needs. So in here, teaching patient is an important role or aspect of a nursing care. So nurses provide effective education strategies to give the patient a better understanding about the situation. So next involves family in interview. So involves family in the interview. So interviewing family provides the nurse with the information that can help the patient and that can help the patient and the family manage chronic illnesses. So by asking question to the family, nurses can gain increased understanding and appreciation. So next, verifies completion of preoperative testing, verifies understanding of surgeon specific preoperative orders. Example dito is yung bowel preparation and preoperative shower. So sa bowel preparation, yung ginagawa dito is ine-empty yung bowels to make sure any problems from infection. So next is the yung preoperative shower. So dito yung ginagawa is yung pre-admission bathing or yung skin cleansing protocols to reduce the microbial burden on the skin of the patient prior to surgery. So next, assesses the patient's need for post-operative transportation and care. So in here, before undergoing surgery, you will ask the doctor what post-operative care will involve. The next, admission to surgical center or unit. So first, you should always have complete preoperative assessment, as I mentioned earlier. And then number 2, assesses for risk for post-operative complications. So dapat alamin mo kung at risk ba yung patient to avoid the complications. And then reports unexpected findings or any deviations from normal. So dito, kapag hindi normal yung findings or unexpected, you should report to avoid complications before the before doing or before undergoing surgery. So verifies the operative consent has been signed. So in here, all the patient has the right to be fully informed about the medical condition. So for example, yung proposed treatment or care ng doctor, every patient or all patient has the right to reject. So kapag naman yung patient is nag-sign talaga ng consent, means it his or her choice na to have that procedure based on her or his full understanding about the treatment, kung magbe-benefit ba siya or kung at risk. So number 5, coordinates patient teaching with other nursing staff. So in here, collaboration with professionals involved is essential. 6, reinforces previous teaching. So dito is yung reteaching. So because not all the patient teaching is successful. Kasi in reality kasi communication in reality communication is often partially understood, misunderstood, and misinterpreted. So even with the best intentions, patient education that fails to educate will lead to poor outcomes. The next, explain the phases in preoperative, perioperative period and expectation. So in here, you will explain to the client the 3 phases, which is the preoperative, intraoperative, and postoperative, and also the expectations. The next answers the patient's and family questions. So by answering the questions of the patient and the family will help the patient and the family to be prepared before, during, and after the operation. So lastly, number 9, develops a plan of care. So why do we need to develop a plan of care? Because it contains all the relevant information about the patient's diagnosis, the goal of the treatment, and including the observations and actions to be performed. So next is in the holding area. So it assesses the patient's status, baseline pain and nutritional status, reviews chart. So reviews chart, yung mga previously recorded data like the dates on the medical record. So identifies the patient. So how do you identify the patient? So you will ask to state his or her name and the birth date, or you can check the you can check the identification band. Next, verifies surgical site and marks site per institutional policy. So in here, clinicians will verify the correct procedure. So if the site is predetermined, the marking site is not required. Next, establishes intravenous line, administer medications if prescribed. So why do we need to administer the medication only prescribed by the doctor para ma-avoid ng patient yung medication error na sinasabi doon. And then number 7, takes measure to ensure patient's comfort. So in here, you will ask the patient how they feel, or are they comfortable or not, or you will much better, you will provide a comfort care. So next, number 8, provides psychological support. So nurses should help the patient deal with the symptoms by providing the emotional support to the patient. And lastly, number 9, communicates patient's emotional status to other appropriate members of the healthcare team. So in here, by meeting their physiological and emotional needs, they improve the health process and help them feel safe and empowered with their own recovery. So that's all for my report.
Hello and good day, sir. So I am Dorica Verica Santos Kong. So I'm going to tackle about assessment of health factor that affect patients pre-operatively. It is kind of evaluations or basis ng health factor na nakakaapekto sa patients before a surgical operation. So, yung risk factor for surgical complications, hindi basta-basta na mag-undergo ng surgery ang isang tao, nagkakaroon ng complications if meron silang mga underlying conditions like hypovolemia. So, hypovolemia, it is the abnormal decrease in the volume of blood plasma. So, ito ay isang condition na kung saan nagkakaroon ng rapid fluid or blood loss kapag may injury. So, kapag may isang hypovolemia ang patient na operahan is delikado kasi magkakaroon ng risk sa life niya due to rapid blood loss. And next is dehydrations or electrolyte imbalance. So, it occurs when you lose more fluid than you take in. Kapag hindi enough ang iniinom na tubig ng isang tao, nadidehydrate siya na magkakaroon ng imbalance sa electrolyte. If ang katawan ay kulang sa electrolyte, nasisira ang function ng katawan natin na nagreresulta ng blood clotting, irregular heartbeat, and blood pressure. And next is nutritional deficit. Nutritional deficits means too small. Deficiencies can lead to a variety health, simple known as malnourished ang patient. And next is extreme of age. Very young or very old. This means that kapag sobrang bata or sobrang tanda, is at risk for surgery complications because hindi kaya ng katawan ng isang sanggol or matatanda ang surgery. So, age does matter in surgery. So, next is extreme of weight, emaciations, obesity. So, emaciations, yung pagkakaroon ng abnormally underweight. Emaciated is to lose too much weight. While the obesity is yung masyadong mataba yung patient na abnormal. Yun na. And infections and sepsis. Infection and sepsis, it can lead to sepsis means nagtitrigger yung infection sa katawan mo. So, if you have already an infection in your body, it can lead to sepsis. So, sepsis can lead to tissue damage, organ failure, and death. Next is toxic conditions. From the word toxic means poisonous that cause serious injuries and damage the liver. Kapag nasira ang liver, wala nang sasalo sa toxins sa katawan, and if ever na ganun ang nangyari, it cause uncontrolled bleeding rather. And next is immunologic abnormalities. It is dysfunctions of immune system. Nagmamalfunctions ang immune system ng isang tao, it can lead to asthma. Kapag mahina ang immune system, madali ka lang ma-infection, madali ka lang matamaan ng sakit. So, next is pulmonary disease. It is a type of disease na nakakaapekto sa lungs and other parts of the respiratory system. It includes obstruct disease, lung disease na kung saan nahihirapan mag-exhale or huminga, in other words, is shortness of breath. And also restrictive disorder. It is a lung disease din na kung saan mag-stiff ang chest wall ng isang tao, naninigas yung chest. And respiratory infection, it is an infections that interfere the normal breathing. Next is renal or urinary tract disease. It is a kidney infection. Renal refers to kidney. It includes decreased renal function, poor function of the kidneys that may due to reductions in blood flow to kidneys. And urinary tract infection, it is an infections that involve your urethra, daluyan ng ihi. And obstruction, blockage of passageway or blockage of urethra. And next is pregnancy. So pregnancy, it is a conditions of being pregnant. That means kapag buntis ang isang babae, hindi siya pwede basta-bastang operahan because at risk siya sa mga surgery complications like diminished maternal physiologic reserve cardiovascular disease. So during pregnancy, there is a physiological increase in blood volume, heart rate, and cardiac output. And the next is coronary artery disease or previous. It is the build-up of plaque in the arteries that supply oxygen-rich blood to your heart. And myocardial infections, permanent damage to heart muscles. And the next is cardiac failure. Cardiac failure is simply known as heart failure. When the heart muscles doesn't pump blood as well, and dysrhythmia, abnormality in the heartbeat or rhythm caused by electrical impulses that aren't functioning properly. And also the hypertension. Hypertension is simply known as a high blood pressure. Blood pressure that is higher than the normal blood. Kapag may hypertension ang isang tao, it can lead to damage to your body, to your blood vessels rather, and organs. Next is prosthetic heart valve. Prosthetic means artificial heart valve. Dahil artificial na lang yung heart valve mo, it is prone to infections, and it's only lasts for 20 years or more. And thromboembolisms rather, and formations in a blood vessels of a clot to plug another vessels. It can cause disability and death. Hemorrhagic disorder, spontaneous bleeding, tuloy-tuloy na pagdurugo. And cerebrovascular disease, it includes stroke. So next is endocrine dysfunction. It is a secret hormone. Endocrine dysfunction, it is a disease that results when a gland produces too much or too little of an endocrine hormone. So, magkakaroon siya ng diabetes mellitus. It is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolisms of carbohydrate and elevated of glucose in the blood and urine. So, and next is adrenal disorder. The kidneys, so this means malfunctions of those ductless glands that result to severe pain in your lower body, weakness, and high blood pressure. Thyroid malfunction, it is a disorder that leads to goiter. It is an abnormal production of thyroid hormone. So next is hepatic disease. It is a liver disease caused by viruses, alcohol use, and obesity. So it can lead to cirrhosis, late stage liver disease due to excessive drinking of alcohol, and hepatitis, inflammations of the liver, pamamaga ng atay. Kapag namamaga ang atay, maapektuhan ang pagfunksyon nito, and also pre-existing mental or physical disability. That's all for my report. Thank you.
Good day, sir. I am Armelina M. Mastel. I'm the next reporter. So next is the surgical classifications. Surgical complications, surgery may be performed for various reasons. So first is to diagnostic. So for example, like the biopsy, exploratory laparotomy. So biopsy, this is the removal tissues from any parts of our body, and exploratory laparotomy, this is the surgery to open the belly area. And next is the curative. Curative is, for example, like excisions of a tumor or an inflamed appendix. So this excision of a tumor or inflamed appendix, this is the surgical treatment that address the bone tumors. Then next is the reparative. This is the example like multiple wound repair. And then next is the reconstructive or the cosmetic. So reconstructive, this is perform on abnormal structures of our parts of our body. While the and cosmetic, which is the perform the reshape of our of the part of structures of the parts of our body. And then next is the palliative. Palliative is like examples to relieve pain. So surgery may also be classified according to the degree of urgency involved: emergent, urgent, required, elective, and optional. So when patient's condition is life-threatening, so the surgery is considered to perform. Life like trauma and appendix, so need to it is important to perform surgery without the consent. So next, let's proceed to the preparations for surgery. Preparations for surgery. First is preparation for surgery is the informed consent. Informed consent, which is voluntary, and a written informed consent from the patient is necessary before non-emergent surgery can be performed in order to protect the patients from unsanctioned surgery. So this informed consent, this is important. This is the approval from the patient. So it is required before non-emergent surgery para to protect the patients before the surgery. And it helps the patients to prepare psychologically because it helps to ensure that the patients understand the surgery performed. So para din naman prepare ang pasyente at maintindihan niya or kung ano yung mga gawin bago ang surgery. And then there are the criteria for the valid informed consent. First is the voluntary consent. Voluntary consent, this is the valid consent must be freely given without coercion. So you don't need to force because this is the valid consent and freely given. So next is the incompetent patient. Incompetent patient is individual who cannot give consent, like for example like individuals who are cognitively impaired, mentally ill, or the neurologically incapacitated. So dito patient individual who cannot who is not unable to take decision for himself or herself because of the disturbance or functioning of his or her brain, like for example like the mentally ill. Okay, so next is the informed subject. Informed subject, which is informed consent in writing. So it should be contain the following. First, explanations of the procedure and its risk. So you need to explain the procedure to the patients and also the risk before doing the surgery. And then next is descriptions of the benefits and alternatives. So you need to describe any benefits and any benefits is to promote also the trust and confidence in the medical professionals. Next is an offer to answer questions about procedure, instructions that the patients may withdraw consent. So you need to give instructions to the patients why the consent, the informed consent is important. A statement informing the patients if the protocol differs from customary procedures. So informed consent is necessary in the following circumstances, like invasive procedures. So first, the invasive procedures. Invasive procedures. These procedures require the required surgery, such as surgical incision. Ang surgical incision, which is a cut made through. So a cut made through the skin and tissues, and to facilitate the operations or the procedures. So, and then next, a biopsy. A biopsy, this is the removal. That's as I said earlier. This is the removal of the tissue from our parts of the body to examine the diseases. And then cystoscopy. This is the procedure to examine the lining tube to carry out lining tube to carry out the urine from our body. And or paracentesis, or this parenthesis, which is the removal fluids from our abdomen to also to diagnose the infections. And then surgical procedure, such as an angiography that carries more than a slight raise to the patient. So angiography, this is uses for the X-ray also to examine to views our body bloods vessels. So next is the patient able to comprehend. So information must be written. If the patient is not English speaking, it is necessary to provide consent that is understandable language delivered to the patient. So if you are going to interview the patient, so if the patients cannot understand English, so you need to adjust. For example, you are a Sinama language, so you are a Sinama, so you need to adjust. You need to speak in Sinama so that the patients can understand what you are going to say or what you're going to interview them. So that's why so to make easier get information from the patients. So that's all for my topic.
I'm Ladja Cambra. My topic is describe the preoperative nursing measures that decrease the risk for infection and other post-operative complications. So, perioperative assessment. Perioperative assessment is performed to address risk factors that otherwise lead to the post-operative complication, and hydrogen recovery, blood X-ray, and other diagnosis tests prescribed when indicated. Information obtained other history of the physical examination. So, preoperative assessment is include health history of the patient and physical examination such as blood test, nutritional and fluid status. Optimal nutrition is essential factor in promoting healing and resisting infection and other surgical complications.
Any nutritional deficiency such as malnutrition should be corrected before the surgery. And drug or alcohol use. People who abuse drugs or alcohol frequently or attempt to hide it. So, in this situation, nurse asks the patient with a patient's care and non-judgmental attitude. Like examples, for example, na, sir, may bisyo ba kayo? So, ganon. And respiratory status. The goal of surgical patient is optimal respiratory function because adequate ventilation and potentially converts during all phases of surgical treatment. Surgery is usually postponed in a patient has a respiratory infection. So in this situation, if ever na meron respiratory infection yung patient, is like example asthma or pulmonary disease, is usually ma-postpone yung surgery. So pulmonary disease is a type of disease that affect the lungs and other part of respiratory system. And cardiovascular status. The goal of preparing any patient for surgery is to ensure a well-functioning cardiovascular system to meet the oxygen and nutritional needs the perioperative period. So cardiovascular status is preparing any patient for the surgery to ensure as well the functioning of the cardiovascular system to meet the oxygen or fluid period. So beside the measuring of BP and heart rate.
Sir, and good morning. I'm the next reporter. My name is Ali Sharati J. Mahadali. The next topic is the hepatic and renal function. The pre-surgical goal is optimal function of the liver and urinary system so that medication, anesthetic agents, body waste, and toxin are adequately proceed and removed from the body. The main goal of the hepatic and renal function is to optimal function of the best function of the hepatic renal function is to optimal the function of the liver and urinary system so that the medication, anesthetic agent, body waste and toxin are adequately proceed and removed from the body. Ang ibig sabihin nun, sir, ang hepatic renal function ay isang gumagawa ng paraan for the best solution, alisin yung mga medication, anesthetic agent, body waste, yung mga dumi sa katawan is naalis na informal. Next is the endocrine function. The patient with diabetes who is undergoing surgery is at risk for hypoglycemia and hyperglycemia. Hyperglycemia may develop during anesthesia or post-operative from indicate carbohydrate or excessive administration of insulin. Ang mga patient na may diabetes na mag-undergo sa isang surgery is mataas yung highly risk yung hypoglycemia na hyperglycemia nila kapag din nagde-develop during the anesthesia sa sunod-sunod na pag inject ng anesthesia sa kanila, kulang ang mga carbohydrate at saka administered insulin sa katawan nila. Kaya ganoon magkaka-high risk ka sa hypoglycemia o hyperglycemia. Next is the immune function. An important function of the preoperative assessment is to determine the presence of allergies. It is especially important to identify and document any sensitive medication and past adverse reaction to this agent. Bale, ang immune function, ito yung important function sa pre-operative assessment kasi dito madidetermine mo ang presence ng allergy sa isang patient at document mo ang past at saka future reaction ng agent na natitake ng isang patient. Next is the previous medication used. Medication history is obtained from each patient because of the possible effect of medication on the patient's perioperative course, including the possibility of drug interaction. Dapat natin i-indicate ang medication history ng isang patient, hindi isang patient lang, sa lahat ng patient, sa ano-ano ang na-take nila na medication, dapat i-document natin para malaman kung ano ang kalabasan ng isang drug sa katawan nila within the interaction. And that's all for my report, sir. Thank you.
Good day, everyone. I am the next reporter. I'm Miraida B. Mercusin. My topic is psychosocial factors. So, all patients have some type of emotional reaction before any surgical procedure, be it obvious or hidden, normal or abnormal. So, according to the psychological facts, it is normal for every patient to have emotional reaction before any surgery. So, in that case, the nurses should provide comfort care. Next is spiritual and cultural beliefs. Spiritual beliefs play an important role in how people cope with fear and anxiety. Regardless of the patient's religious affiliation, spiritual beliefs can be as therapeutic as medication. So, every patient, they have their own beliefs or paniniwala. So, as a nurse, dapat yun i-consider or i-understand because yung paniniwala nila, it is considered as therapeutic medication. So next is preoperative teaching. Nurses have long recognized the value of preoperative instruction. Each patient is taught as an individual with consideration for any unique concerns or learning needs. So the main goal of preoperative education is not only to teach the patient before any surgery, but also to prepare themselves for what happened after the surgery. So the lastly is deep breathing, cupping, and incentive spirometry. One goal of preoperative nursing care is to teach the patient how to promote optimal lung expansion and consequent blood oxygenation after anesthesia. So, one goal ng preoperative nursing is dapat the patient should teach on how to promote optimal lung expansion because anesthesia because general anesthesia, it decreases oxygenation in the post-anesthesia period and it collapses the lung tissue independent region and airway. So that is why dapat the patient should promote optimal lung expansion and consequent blood oxygenation after anesthesia. Next is the patient assumes a sitting position to enhance lung expansion. So dapat the patient naka-sitting position para ma-enhance ang lung expansion. Lastly is the nurse then demonstrate how to take a slow breath and how to exhale slowly. So yung nurse dapat i-demonstrate sa patient the slow breath and how to exhale slowly. That's all. Thank you.
Okay, I'm the next reporter. My name is Medja Malisan. So my topic is mobility in active body movement. So the goals of promoting mobility post-operatively are to improve circulation, prevent venous stasis, and promote optimal respiratory function. It's any special position the patient needs to maintain after surgery, for example, adduction or elevation of an extremity. So yung mobility in active body movement, so kailangan niyang magalaw yung kanyang katawan after surgery. Kailangan din turuan ng mga strategies. Example is kailangan niyang elevate ang kanyang lower extremity. Next is pain management. Pain intensity scales should be introduced and explained to the patient to promote more effective post-operatively pain management. So, yung pain management is kailangan natin explain sa patient para malaman niya at naturuan siya kung paano i-manage yung pain. And next is cognitive coping strategies. Cognitive strategies may be used for relieving tension, overcoming anxiety, decreasing fear, and achieving relaxation. For examples of such strategies include the following: imagery, distraction, and optimistic self-recitation. Yung cognitive strategies, ito yung strategies na kailangan natin na ituro sa mga pasyente para may ability sila to imagine, to yung mga distract and optimistic self-recitation. And next is instruction for patients undergoing ambulatory surgery. Preoperatively education for the same day or ambulatory surgical patient comprises all the material presented earlier in this chapter, as well as collaboratively planning with the patient and family for discharge and follow-up home care. The major difference in outpatient preoperative education is teaching environment. And that would be all.
So I hope you gain a few knowledge from our discussions all about the preoperative basics. So that's all.